Hi Skincare Lovelies, I'm going to be talking to you about step-up therapy in melasma. So our foundation principle, first part, is always skincare. If we don't start from protection, that's your sunscreen, your antioxidant, we don't hit go. So always first sunscreen, antioxidant serum, our protection in the daytime. Then we go to quietening down the pigment cells effectively, so our correctors, our lifters of pigmentation. These are our foundation principles. Once we've got that right in place, then we're stepping up. Step up can include things like chemical peels done safely with appropriate ingredients, appropriate concentrations, maybe something with a glycolic 20, a lactic acid 20, so you get a gentle lift but hydration support with the lactic acid incorporated. You can also include ingredients like tranexamic in a peel, very helpful there. However, many of my patients who've come to me have tried peels and have been frustrated with results. So this is for the patient, or this is you, someone who's attempted many different treatment modalities, aren't seeing the results you want. So when we get to a laser, it's definitely a step up in our treatment protocol. And it's a step up because it's not something we take lightly in terms of protocol. It can come with complication or adverse effect. Why is that? Because laser, essentially, you're delivering energy into the skin. And remember, I spoke to you at the beginning of the series about the melanocyte, or the pigment cell, being hyper-irritable, just sensitive, wanting to throw a tantrum to any form of stimulus. And so if you're sending in energy, you may then be inviting a tantrum in the skin. There have been many different laser modalities used for the treatment of melasma with variable effect. And what's used mostly presently are two lasers. One is the picosecond and one is the Q-switched Nd:YAG. Both come with benefit, but again, you have to be mindful about how you're going about using your energy. Here at the dermatology room, we use a Q-switched Nd:YAG, and that's the Hollywood Spectra. But it's a very special way this energy is delivered. Now, we're going to talk a little bit about Q-switched technology. Basically, what that means is you get a quick spike of energy in the wavelength. And theoretically, because that energy is delivered really quickly, it's not supposed to be transmitted to the surrounding skin, so we aren't supposed to get offset in terms of inflammation. That's theoretical. Unfortunately, you'll still get incidences where you do find pigmentation being offset, so precisely what you don't want to see happening in the skin, which is where we bring in the laser toning technology. You take that same Q-switched Nd:YAG laser, but you deliver the energy or the wavelength smartly. So instead of one quick spike, it's multiple short spikes over that same time duration. So the skin is tricked into thinking it's getting the same energy, but it's doing so much more safely over short treatment duration, same wavelength time. And so you get the same efficacy, but safely so without a rebound pigmentation. And that's what we're chasing. We're looking for clinical results, but we're looking for that without any irritation. Especially, sometimes you can have a laser done and you'll see a beautiful result, but maybe in the month, 2 months, 3 months to follow, you do get a rebound pigmentation offset. So you want to be mindful about that. So we've had the Hollywood Spectra here at the practice. It's the first on the continent. So we're really pleased to be able to deliver this technology to our patients. It's FDA approved for melasma, including on skin of color, so skin with deeper tones. And we've been using this laser here for a good year now. Patients are so happy with the result. It's so lovely to see, to be able to provide a meaningful result, and safely so. So we haven't been getting any rebound, which is also a really important thing to let you know about. How we do the treatment sessions, initially a bit more intensely at the beginning, then we go to monthly, 2 monthly, 3 monthly. Eventually you're here once a quarter to once every 6 months, so it's just a maintenance thing. Remember, we can't cure the melasma, so we just want to keep it quiet, get it under control, and then keep it quiet. So you need me a little bit more at the outset of the program, and then you, by maintaining with your good skincare, can hold that result more meaningfully at home with fewer treatments, wider intervals between. I hope you found that helpful. If you'd like to know a little bit more, please leave a comment. If you like the content, please like, follow, subscribe, or we'd be happy to hear from you if you have any further questions at the dermatology room. Keep well, skincare lovelies.